In Mosiro, Kajiado West, one of the most remote places in the vast Kajiado County, the most dramatic stories are played out. Mukes Purwo, a 53-year-old traditional bath attendant, shows us what expectant women have to go through before and even as they deliver, often at home. It has been a harsh reality. Sometimes there are complications. Mukes and more of her peers are helping more women deliver in health facilities, and with the help of community health volunteers, they're educating them on the benefits of hospital deliveries.
Najua tu kwa kijiji fulani kuna wamama ambao wako karibu kuzaa kiasi fulani ama namba fulani. So nahakikisha hao mama wote wamekuja kwenda wapi? Wamekuja kwenda maternity na wazalie huko.
This is Kelea Olempusia's homestead, 5 kilometers from the nearest health center. Of the 50 children who live here, 30 were born in the Mosiro Health Center, a health facility that serves the people living around here. But it doesn't stay open throughout the night. And when the patients develop complications, they have to be referred to other health facilities, the nearest being the Narok County Hospital. Access and transport still remains a big challenge. From Mosiro, the nearest referral is in Narok, 68 kilometers away. It would cost 1,600 shillings on average for a one-way trip. Maternal services are free. The county's top diseases are TB, pneumonia, diarrhea, and skin diseases. Many in the villages cannot afford the treatment. The county government had to find a local solution. This year, the county governor initiated the Mbuzi Moja Afya Bora initiative. The concept was for each family to sacrifice one goat, whose value is the equivalent of 6,000 shillings, to cater for 1 year's medical cover.
Mudosi ameniambia nimununulie mbuzi 700.
The last auction was held on September 3rd, 2018, presided by the deputy president.
Nilichukua mbuzi yangu hapa, nikapeleka mpaka Kajiado. Wesi tu utatoa tu mbuzi ovyo ovyo. Lakini ukielezwa ya kwamba hii mbuzi yako itakufaidi na hii atatoa.
It's easier to borrow a goat than to actually borrow money. The third phase of that is a county insurance scheme, which will complement the NHIF scheme. Because usually sometimes they don't pay the whole amount.
At the Kajiado Referral Hospital, Eunice Parsanka, a 25-year-old teacher, has just given birth via C-section to her second child, Dylan. Hers was a self-referral.
My first baby nilimpata huku pia na services zao zilikuwa mzuri. Ni mahali ambapo ukikuja hata ukikuja saa 9 usiku unapata madaktari.
Under the managed equipment scheme, we have a radiology department that is working well, and also theater. We get referrals from very far places and where the road network is not very well. And by the time they get to the hospital, you find that the situation now is either complicated or dire.
The Kitengela Sub-County Hospital is one of the 2 main health facilities in Kajiado East. The other one is the Isinya Health Center. In this facility, with 117 county staff, it serves even patients coming from Machakos County.
We want to have every citizen of Kajiado access medical services wherever they are.
And in a county of such stark contrasts, those still without access are hanging on to the promise of universal health coverage. Dorcas Wangera, Citizen TV, Kajiado.